Now, I came from an accounting background, so when you give me a number and a list, someone called it a listicle once, but when you give me a list of things, that's like I'm kind of drawn to that. I kind of like that idea of a list. And so you identified five characteristics that increase the risk of adverse drug events. Like I said, I
Yeah.
think most of us want to avoid that. Can you talk about each of those briefly and why they're important?
Yeah, sure. So I present the five cat characteristics as when you look at them together, it's kind of unique for the older adult population. And in medicine, we talk about age 65 and older is the cutoff of sorts. Um, and so those five points. The first one is taking multiple medications puts you at increased risk of having an adverse drug event. And that kind of makes sense. The more medicines you're exposed to, the greater the chances are of having a problem from them. Why does this happen? Lots of reasons, but one is we have more chronic conditions as we get older, and that leads to the need often for at least one medicine, but sometimes two or three, depending on the condition, right? We think about diabetes and even heart failure and other conditions where you need several medicines. The other characteristic is, or the second characteristic is the involvement of multiple physicians in the care on your care team. So think about how our healthcare today is a little bit divided. We have specialists all over the place. Um, the number of older adults who are seeing specialists has almost doubled in the last 20 years. So that's something to think about when physicians are prescribing their own medicines for you. Are they communicating with each other? Do those medicines interact? Does one physician know everything that you're taking? So that's where some of those other risk factors come in when you have more prescribers involved
and
in
and
your care.
having been, I worked in a pharmacy when I was in college, and
Okay.
and I can tell you the pharmacists back there, yeah, they've got the little computers, and but they are so slammed to just keep turning pills out because the
Yeah,
retail environment is just,
it's
they will do a consult with you, but it's even hard for them if they're just seeing a script, unless the computer tells them there's a definite deal. But this goes
problematic.
even further to say, okay, because two doctors talking to each other, a pharmacist looking at it, you could get your stuff filled in the same place, and it doesn't necessarily mean it's being reviewed and covered off. So
And there's some safeguards in place. I don't want to
yeah,
scare people, but definitely not all of the information is at the pharmacy system, and we can go into how to know if medication is the right choice, the right drug for a person. We have to have some of that medical information, the health background, which pharmacy systems don't have. So yeah,
yeah.
that's another concern, right? We can only do so much checking at that community retail dispensing setting. Um, so clearly, the more doctors involved, studies have shown that there's an increased risk of having an adverse drug event occurring. The next two reasons kind of go together, and they're big words, but I do introduce them in the book. I think it's important for people to at least know these terms are there, and then talk about them in more with easier words. Pharmacokinetics and pharmacodynamics, and this simply refers to pharmacokinetics is how our body handles medications, and as we get older, our body handles medications differently. Our kidney function changes, our liver function changes, um, and that impacts how our bodies process and get those medications out of our system. Some medications can have a much longer duration in the body because of these pharmacokinetic changes, if you will. So suddenly, as we get older, we might need lower doses, or we might need to avoid certain medications because our bodies are handling medicines differently. So that piece is that's a third characteristic that's really important. And then the fourth one I mentioned, pharmacodynamics, another big word, but that simply refers to how the drug affects our body. And the most simple way to address this for older adults to understand how our bodies change and deal with these medicines differently is our bodies are more sensitive to the effects of medications as we get older. And that's the pharmacodynamic piece. But that really means maybe smaller doses will be just as good for older adults. It means that there's certain drug classes that we might want to avoid as we get older because we're more susceptible to having a more significant side effect like drowsiness, dizziness, that fall risk, things like that. And then the fifth characteristic I include is the fact that older adults are not enrolled in clinical trials as much as the younger population, those under 65 years old. And that's because it's hard to study a drug, its effectiveness, if a person is taking many other medications and has many other health conditions. So it's not as clean, if you will. But we cannot know how a drug will affect an older person or an older person with different health conditions unless we study or have it exposed in someone with those conditions. So that means when a drug is newly available on the market after it's been approved by the FDA, we may or may not know exactly how the safety and effectiveness in an older individual. So those five characteristics, putting them together, kind of make that older adult a little more that more unique situation and at higher risk of having an adverse drug event.
Yeah.